Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course where we do encourage you to call in to join in. Folks, we are in our summer mode, our top doc summer mode, as you know by now. Got the best top 20 alternative doctors in the United States that we're going to be bringing on the show with regularity. It all started a few weeks back at the big conference out there in Phoenix, Arizona, where all 20 of these doctors met. Got a chance to put the book together. Each wrote a chapter, and I was able to persuade, not too difficult either, to persuade them to come aboard, come on back to my listeners and explain the message that they wrote so eloquently in the book with the group there, and done now will do so well with you. So you have seen how this has worked. You've met some absolutely great clinicians and doctors over the few weeks we've been involved so far. It's going to take the rest of the summer to get them all done, but the June group is coming in with great regularity and with efficiency. Today is no exception. You got a real rock star here today, folks. His name is David Steenblock. He has been, I say bad boy, I hope he doesn't get upset with me. He has been involved with at the spearhead point in so many unique therapies, usually ones that governmental agencies don't like you involved with. That's where you'll find David Steenblock. And I guess there's no better representative of how that works than his current joy and involvement, which is in stem cells. So yeah, you'd expect to find David Steenblock doing something with something that's hot, really hot, stem cells, and we're going to be talking about him today, and what he does with stem cells and educating you and make you aware of how it is that stem cells may actually change your course of medical and medical future. So if and during our discussion today, you want to call in to ask a question or make a comment, the number to do so is, you know by now. Dial us up at 412-825-6262. That's 412-825-6262. I'll listen for that knock on the door, and I will let you in the store. Okay, as we say, June is moving along at a pretty good clip now. I'll be with you on Friday. We'll do some ozone moments. Of course, we've got the Ozone Express working really hot and heavy here in the office. A lot of folks are taking advantage of it. Enjoyed bringing you a couple of testimonials last week. We'll do something with it here on Friday. And then next Monday is the last day of the month. It's going to be tied into the first week in July because Susie Weiss will be with us on Monday. She's going to be talking about young living and the use of essential oils. She does so because she comes to my office each first Thursday of the month and does a free seminar here in the office. If you think you'd like to learn more about essential oils, and in particular the oils manufactured and put together by Young Living, give us a call here at the office at 724-942-3002. We'll reserve a seat for you. You'll be in the next Thursday group. She's having a great old time out there, and the people who are participating really enjoy the opportunity to learn more about the essential oils. As we flip and look into the month of July, we're going to have Jimmy Barber, a local plastic surgeon, will be here on the show on the 7th, talking about genomic cancer testing, inter-office testing for screening where there's a family situation going on, and people want to know, geez, what's my chances of getting that cancer? Well, there's actually genomic testing available for it, and insurance covered to boot. Then one of the other top docs says we've got him scheduled right now. Nicholas Meyer is a dentist who was in the top doc group out in Phoenix, Arizona. A couple more that are pending. I'll wait until I have them inked before I actually give you their name and the dates they're going to be with us. But July is going to be have as much activity in it as June ever did. Now, we've got let's see, the Ozone Therapy working very well here. Whether you have a pain problem and a chronic pain problem in an isolated area or a systemic issue going on, Ozone Therapy turns out to have a wonderful opportunity to get that reversed for you. We've talked about it a great deal with the godfather himself, Dr. Frank Schallenberger, and we'll be bringing him back, and not just in voice alone. We have to be able to bring him back here to Pittsburgh area in as soon as we return back from summer. We're trying to shoot for September. I'll let you know more about it as time marches on. Don't forget, too, our entire product line, especially this newest addition to the products we offer you, Neo 40, a way to elevate the nitric oxide levels in the blood, are found at the PittsburghEyeProtocol.com. So if you want to head to the website, you can purchase all of the products that I recommend online at that site, PittsburghEyeProtocol.com. Dial it up, and you'll be able to order up without leaving your home. Okay, let's do this. Take a short break. In the interim, I'm going to bring you a fantastic guest today. He is a rock star when it comes to everything that's alternative. And when he gets involved in something, folks, he takes it to the max. You'll love to learn today about stem cells from the guy who ought to know, Dr. David Steenblock. Be right back. Best to manage your health. It's no wonder.
Well, do you think maybe he slept in because I haven't gotten the call yet?
Oh, really? You can try.
I mean, I don't know if he said he's in California, right?
In California, but he's supposed to do it at 5:05 his time.
So should I attempt to wake him up?
Well, I'll give you one more additional number, and let's try to revive him. I gave you his cell. Here's his home, okay?
Mm-hmm.
So the one I gave you before, and this is home. 949-661-0797.
Okay.
All right?
I'll double beep you because I'm not going to have him before the end of the break.
Okay.
So I'll double beep you to let you know if I have him.
Okay.
Alrighty.
All right.
Murray, phone 724-942-3002.
Always feeling tired, stressed? You turn to food to feel better and still wind up tired, stressed, and overweight. We at Avenue to Wellness can help. Using medications and nutritional supplements, we can help you control your appetite, relieve your stress, and give you the energy to enjoy life. These are powerful medications and supplements that only a doctor can prescribe. Dr. Sherman at Avenue to Wellness can create the plan that works best for you. Call 412-646-1063 for a free computerized evaluation. Stop suffering and give yourself the gift of happiness. 412-646-1063. Start on the path to more energy and less stress. 412-646-1063.
Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Wednesday morning version of the show. Our guest today, Dr. David Steenblock, hasn't checked in with us yet. Well, we'll get Bill on this one, and he'll run that down. And while we're waiting for our link to be established with David. Spend some time here by switching a little bit of gear, not too far askew, because ozone therapy is always at the tip of my tongue to discuss with you. Thought maybe I'd spend a moment for those of you out there listening, and I'm coming across a number of you who have become really intrigued with the potential for ozone therapy. I can understand why the intrigue, and whether or not it's a systemic problem or a chronic pain problem where it just may be a body part or a joint. Ozone therapy offers a great potential to get that particular problem reversed completely. When it comes to the joints and of the body, this is a invention or a therapy literally created by the great Frank Schallenberger. He entitles that treatment Prolozone. So let me just spend a moment talking about how you, as a potential patient, need to be looking at the Prolozone issue with respect to becoming involved with it. Now, whether the joint involved, and it doesn't have to be a joint, so many of the people that I'm seeing are having pain and discomfort across many different joints, and others maybe just an isolated one or two. But for sure, they're having a pain problem that's been lasting for, if not months, many, many years, and have tried just about every possibility in alleviating that pain and not having much success. This is probably the most feared component of this joint pain, because no matter what is tried, nothing seems to ever get that turned around. And Dr. Schallenberger, and I would refer you, by the way, to the show done with Dr. Schallenberger. It was on April 4th, and you'll find it in the archives under Ozone 3. We did 3 shows with Frank, Ozone 1, 2, and 3. One was in January, one in February, and this third one in April 4th, where he went and discussed great length what Prolozone was, the injection of ozone directly into a joint. And loud and clear, the message that he conveys to all of his students, and the message that comes across to you as a potential patient, is there's a way to completely correct the pain problem, that's for sure. And then on a long term, probably correct the pathology that led to the pain problem to begin with. Those are 2 just unbelievable possibilities that I know you think doesn't seem like really could happen. Well, it happens at all times around here. We're finding it begin almost with the first treatments that we use here. What you need to appreciate is our protocol, which I want to take just a moment to discuss the ozone protocol for chronic pain. And it'll go something like this. The first 3 treatments that we will use will be major autohemotherapies. In other words, these are IV therapies that have a complete distribution of ozone through all tissues of the body. And we see varied responses with this. I have some patients that do extremely well with just that component alone. You may remember one of our testimonials given last week by a young lady named Donna with shoulder pain. She had this shoulder pain for many, many months, and had it completely relieved with the first IV treatment. So she was unique in that regard. Then the very next individual who came on our show last week talked about how those IVs really didn't help him at all. So I never know which way you're going to respond, other than to say that for the benefit of everybody, all people interested in obtaining ozone therapy have their first treatments as being constituted by the major autohemotherapy, where ozone is delivered through an IV back into the blood. Once an IV is established, a saline solution hung above, 60 cc's of blood are taken from the patient and placed in the IV solution of the saline, and then the large syringe, 60 cc's worth of ozone gas, is injected into the IV bag. And before the gas has a chance to even make it to the top of that fluid column, it's gone. There is no more ozone. The ozone, the third oxygen molecule of this O3 complex, is so unstable and so highly reactive that it has reacted with the double bonds found in the fats of your blood and created an interesting material, substance called an ozonide. That ozonide is the one that's going to do all the great work, because as quickly as we lost ozone, we formed ozonide, and the ozonide lives now for weeks, being able to enter the body and move to wherever it needs to do its wonderful work. The wonderful work that appears to be universally possible with the use of the ozonide given back to you is to take what we now realize is the common link found in all diseases. You name it, the disease always has this one component unique to all of them, all the diseases that is, which is that the mitochondria at the level of the nucleus of the cell is not making energy optimally. The form of energy that's made is a chemical form called ATP, and if you can't make enough of it, the cells that are trying to make it but not able to will not function correctly. And whatever body system that is, that system will manifest the symptoms associated and expected to appear whenever that system is involved. So if it's a kidney disease, the kidneys aren't going to be working well, the urine's going to be affected, urine production is going to be affected. If it's the liver's not going to be able to detoxify as well. If it is the pancreas, there's going to be a problem with insulin and exocrine function. The list goes on and on and on. But when we have the ability to make the mitochondrial energy equation become optimal, then those cells work optimally, performing the function to almost near flawless, and that's when whatever disease you're correcting will finally have its opportunity to get turned around. So, when you're doing the Prolozone protocol, the first three are major autohemotherapies. The next appointment is slightly different. On that particular appointment, we inject all scars. Number 2, all pertinent trigger points. And number 3, all pertinent and relevant subcutaneous areas where pain emanates from. It's a day that I'll get a lot of question marks, a lot of whimsical faces, because patients are saying, why in the heck are we injecting my, let's say, appendix scar? Or how about this one? Women say, well, yes, I have a scar. I have a very large hysterectomy scar. Turns out these have problems associated with them, and that they have caused tugging and pulling on the fascia of the body, which I compare to as a form-fitted sheet placed on a bed with the corners really pulled over the edge so that there's not a crease or wrinkle in that sheet. But if you were to take the corner of that sheet and gather it just with a pinch and pull slightly, you would provoke the formation of a stress line all the way to the other extreme corner of that form-fitted sheet. And that's the kind of stress line that forms whenever any surgeon takes and uses suture material to gather the wound together. Well, your sheet is called fascia, and your fascia gets stress lines in it, and those stress lines absolutely play a role in chronic pain. We have to relieve the stress by injecting the scars with ozone, and I can tell you that there have been some miraculous turnarounds with that set of injections alone. So, 3 major autohemotherapies, followed by the injection of scars, trigger points, and pertinent subcutaneous tissue, finally brings the person to the first of the Prolozone therapies. Whatever joints are decided on, the only limitation that we have is the use of the Prolozone solution, which contains procaine, has about a 15 cc limit. You wouldn't want to go over 15 cc's total, and so within the context of that limit, we will attack wherever we find that there's high priority. Usually it's been knees up to now. Knees are a big one. What's another one? Ankles, big one, and shoulder. I guess these three have come up over and over and over again. Anyway, patient enters on those days. We try to find out what form of activity provokes the most discomfort. We then use a prolozone solution injected in the joint, and then finally administer ozone itself into the joint and fill that cavity up with that gas mixed with the solution. Patients must leave on that day pain-free. It is an anesthetic phenomenon. That's not that we've fixed everything. It just says that we put the ozone in the solution in the right spots. What will happen next is after the patient returns home, and by the time we've seen him for the next appointment, we will then ask him, how much have you improved since your first ozone treatment? And give me a percentage. And that's when we hear it. We hear things like, well, I'm 30% better, I'm 50% better, I'm 75% better, or whatever. And we build upon that until we finally get all 100% of the pain gone. I know it seems like an impossibility to you, especially if you've been suffering for a while, but that's my plug for the ozone. I say to you that ozone cannot hurt you. It's only oxygen, but it has a wonderful potential benefit to help you, and you should take us up on that offer. Come on in to see us. Set up an appointment by calling us at 724-942-3002. That's 724-942-3002, and we'll get to work on your pain problem as soon as we possibly can. All right. I think I'm going to declare a complete switching of the gears. Usually by this point we've either established with our guest of the day or we're not going to. So we're going to take and let you come on and set the agenda around here as you see it. We're going to open them up. It's an open phone Wednesday, a little unique, but I've got some things I'll share with you. Please come aboard and share some things with us. You do that by dialing us up at 412-825-6262. We'll be back in just a moment.
Those pounds.
Called the cell, left a message, called the home number, and you get one of those, generic.
Yeah.
So I didn't, figuring I already left one on his cell, I didn't leave any message there.
Okay, gotcha. We're just switching off.
Could be, anything. At 5 in the morning, who knows what's going on out there. So, alrighty.
Yep.
Healthier, happier life. That's 41.
Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Right here in KHV 620 on a Wednesday morning version of the show. We're going to switch some gears. Our guest today, Dr. David Steenblock, for some reason, and by the way, he is out on the West Coast, so easily enough that something could have happened. It's 5 o'clock out there. Anyway, we will reschedule with him. We'll find out what happened, and I promise to bring him back to you. But we've switched gears here to allow you to take over if you'd like to. You can give us a call on any issue that has been, well, maybe has been mounting up. We're spending so much time on introducing you to new talent and the new doctors with new messages. You just might be thankful for a bit of a pause and want to ask questions on a multitude of issues. Feel free to do that by dialing us up at 412-825-6262. That's 412-825-6262. I'll listen for that knock on the door, and I will let you in the store. Now, oddly enough, I'll share with you, got an email from our good friend Dr. Lee Kalma. You know, he was our guest 1 week ago today. Very powerful doctor talking to us about, the emotional component of chronic disease. I thought that was a fantastic discussion that we had that day. Never had that discussion before with a medical doctor, especially on the air. And then quite a bit of discussion about Lyme's disease, which is one of his specialty areas. I mention him because I rarely get what happened to me yesterday. And that is, I got an email from Dr. Cowden which said essentially, look, I want to come on your show and I want to talk about cancer therapies. Will you allow me to come back? And I don't think it's ever happened in all the years I've been doing this, but for some reason, Dr. Cowden likes all you folks, and I couldn't email him fast enough to let him know that there's some slots open in the month of July, that if he'd like to, I'll be more than happy to bring him on board. I emailed him. I didn't get a response back, but I promise you Dr. Lee Cowden's coming back. What a powerful set of messages he has. And on the cancer issue, which was one of his presentations out in Phoenix, Arizona, an impeccable presentation. I hope he uses the same one here. So anyway, Dr. Lee Kalma going to be coming back. He enjoyed it the first time and wants to have a second opportunity to do it. Hey, we have a knock on the door. Come on in the store. Hello and welcome aboard. What's on your mind? And go right ahead.
I was calling regarding the ozone therapy. Would that be effective for a bulging or herniated disc in the lumbar area?
Yeah. You name it, then the diagnosis, you just fill in the blank. If you're having pain in a disc, and let's say this, what if you have disc issues and you've been seen by a surgeon and the surgeon actually says, you know, you need to have that surgery to have that fixed. I don't know if that's your particular situation, because I have so many other people that have these disc issues and the surgeon hasn't told them to have a surgery. But Dr. Schallenberger was quite clear about this. No matter what the cause for the pain, ozone therapy has an absolute wonderful opportunity to correct the problem, even when you have a known diagnosis like that. And even in the setting where surgery has been recommended, ozone appears to be able to reverse even those conditions. So putting surgery last, as one I would hope would want to do,
right?
You absolutely
yes.
Yeah. So that option to you to put it back at the back burner is absolutely in keeping with what Dr. Schallenberger's work with. And I can tell you, he strongly urges don't ever have that surgery, no matter how clear-cut the indications will be, without trying to avoid it with ozone first. And he's got a career worth of this. So I'm real clear on my answer to your question, because it's come up many times before.
Right. And if the problem is corrected, is the treatment necessary to be ongoing?
No. One thing unique about the joint issues or the individual regional pain problems, he's quite clear about the fact it should be for and done, which I think is an interesting concept for a guy like myself who's been working with chronic pain for 20 years. And unfortunately, I felt that I could help everybody, but no one ever got to the point where we were done. You know what I mean? It was like we could continue this for an eternity. But with the ozone therapies that Dr. Schallenberger uses, by the fourth prolozone treatment, we're done. And probably only look to have a maintenance level of once a month or once every 3 months, just to ensure that the pain is kept at bay and away.
Okay. And what would be the time frame for the 4 treatment levels?
Well, the clock runs as quick as you want it to with respect to getting the first 3 chemotherapies out of the way.
Okay.
So I've told patients that if they needed to, they can do 1 a day for 3 days in a row. Doesn't matter to me. Others space that out a little more. And then the appointment with the scars, that's on you. When we finally get to Prolozone, then I set the agenda and I say the first treatment once given is followed up by the second treatment 2 weeks later. The third treatment for Prolozone is 3 weeks after that. The next one is 3 weeks after that. And the final one is 4 weeks after that. Pretty clear cut.
Yeah. And do you have to restrict your activities accordingly during that time frame?
Actually, not so much as you might think. Whatever, and we're utilizing a check and balance of having patients try to do a maneuver to elicit their pain before we use Prolozone and Ozone. To the extent of trying to say to them, all right, what is it that you do that you know if you do it, you're going to get a lot of pain? So everybody has this sort of the thing they can't do. Then once we have determined what that is, we're going to be using the Ozone/Prolozone injection. And the first rule is you don't leave unless 100% of the pain is gone to indicate that we got the ozone and the Prolozone in the right area. Because if we did that, then there is no pain on the day that we injected you. 2 weeks later is where we find out how much were we able to remove completely. And I think it's normal to hear from a patient to tell me they're 50% better and they've held it for the full 2 weeks whenever I see them for the second time. You can just build on that. And you're working to get to 100% pain relief. And Schallenberger's pretty clear about 4 and done.
Good.
Okay?
Okay, I appreciate that information.
Absolutely. Hope to see you soon.
Thank you.
There you go. So it should work, folks. I know it, and even for a chronic pain doctor like myself, I've been amazed at how effective ozone therapies can be in getting these pain problems turned around. And I had not stuttered when I answered the question a moment ago. I'll say it again. Frank feels it's 4 and done. And so do I. Hey, we got another knock on the door. Come on in the store. Hello and welcome aboard. What's on your mind?
Good morning, Dr. Courtney.
Hi.
Hi. Just had a question on the low-dose naltrexone.
Sure.
If I decided to try that, could I actually talk to someone who's been on it for a while just to...
Yeah, we have a number of people who are on it.
Okay.
Of course, you know that the dosing for low-dose naltrexone, which is a drug that's an agonist-antagonist, okay? Funny combination for a drug, but that's an interesting drug that we in anesthesia, because you know I'm an anesthesiologist, and when they were experimenting with that drug to bring it out in the market, they brought it to us first. And I can tell you that the dosing at the time was 100 milligrams given IV. Of course, in the anesthesia world, just about everything we give is IV. Nobody's taking tablets to have their anesthetic given to them. My point is this. At 4.5 milligrams nightly, that is just a drop in the bucket. When the dose that was given back then, and still today in the operating room situation, is 100 milligrams IV. So at 4.5 milligrams, there's not much to worry about that can go on. Yet, we have a host of people that are on that substance, and as long as they agree to speak to you, I don't have a problem with it.
Okay, so the starting dose is always 4.5, and then what is the highest someone can go up for the...
Oh, no, you misunderstand. It's 4.5 forever.
Oh, okay, because I was reading a book that said you start out at 3 and you can work up to as much as 10.
I'll tell you what, I'm pretty clear with how I've used this, and my colleagues that I have great respect with all use it. This mystical 4.5. I know who decided. His name is Michael Schachter. He's the guy who really came up with this whole concept in New York City. But 4.5 milligrams is what you start with, and that's what you stay with. And that low dose, and that really is low dose, appears to have some great benefit and without any side effect. At 4.5 milligrams, you're not going to have a side effect with naltrexone.
Okay.
Okay?
And if I decide to do the ozone, would it be okay to do those two kind of together?
Oh, yeah. Sure.
Okay.
Yeah.
Okay.
Absolutely.
And in the back of my mind, I wanted to get back to doing chelation. You know.
For heavy metals or for plaque or for both?
Actually, even back in the day when they asked me to do the heavy metal, you know, burden test, I don't even remember if they did it on me or not, but I'm actually doing it for just the arteries, and not just, but I know people have heavy metal burden, and I'm just assuming I do. I'm doing it from the aspects of opening up my small blood vessels,
there you go.
Diabetes,
sure.
Doing it for the arterial, I can't pronounce it, arterial sclerosis, you know.
Arterial sclerosis or atherosclerosis?
Opening it up in for, you know, just my eyes and everything, because I know it's very protective. And for me, the side benefit would, of course, be getting rid of some heavy metals, but I know I need to get back to doing that. So I don't know if this is feasible because of monetary issues, but is it okay if I did all three at the same time?
Yeah, okay. Sure. Yeah, absolutely.
I mean, obviously different times with the ozone and the chelation, but sort of, you know, concurrently, you know.
Come on down. Absolutely. All three can be done. Okay?
That's what's nice about your office, Dr. Courtney. You can have it all done at, you know, so many different things in one office.
Yeah, we sort of have multiple different roads to take, and as long as one therapy isn't conflicting with the other, that's a harmonious thing to do. It really is. It's not something that would be something to avoid. It's something to really look forward to, that you can work on a number of different aspects at one time.
All right, sounds good. Thank you.
Absolutely, my pleasure. Hope to see you soon. There you go. Naltrexone, low-dose naltrexone, actually worked very well with some folks. The first time it was used is really in cancer patients. And once placed on it, they just stay on that dose forever. Okay, you see how it works around here. You may have a question. You may have a comment. Something we've talked about on the air recently that may have tickled your fancy. Give us a call at 412-825-6262 if you'd like to ask a question too, or if you want to make a comment, 412-825-6262. Now, I saw where we had our supplies replenished with this Neo 40, flying off the shelves, folks. I'm using it in a whole bunch of venues, but one in particular is to raise the nitric oxide level in the blood so that we can get a drop in blood pressure and get people off blood pressure medications. This absolutely looks as though it's the greatest place where Neo 40 can have a benefit, although it can have so many others. And so it starts out, this substance, this product, is a product that was invented by Brian Nathan, and he works for a company called Neogenesis. And it utilizes the bacterial flora of the mouth. Well, this is the part we didn't know, that the nitric oxide levels of the body of the human being are generated from the bacterial flora in the mouth, which is able to break down foods that contain high amounts of nitrates. Now, there is a little mechanism that takes the mouth and the duodenum to form the nitric oxide, but it's happening in the mouth, and as such can be tested with testing strips to find out what your nitric oxide status is, and then you can go about increasing that level and have a visual check with those sticks to know that you've arrived at the dose you want to. Once there, I suggest that all sorts of wonderful things can happen when it comes to eliminating blood pressure medicines, because at that point you shouldn't need the blood pressure medicine anymore. But Neo 40 back on the shelves here. You can also get it at the website at pittsburghiprotocol.com. pittsburghiprotocol.com. Just go to the product section and you can order it online. Hey, we got another knock on the door. Come on, the store. Hello, welcome aboard. What's on your mind?
Hey, good morning, Dr. Courtney.
Hey, how are you?
Hey, just living the dream, Doc, living the dream. But feel free to give Kathy my number as far as low-dose naltrexone. As you know, I've been on that for years, off and on, and have nothing but great things to say about it. I'm sure it helps me with my primary concern. But, to a degree, that's a little hard to assess. But as far as side effects, I had two. One is I used to get a growth on my nose, and I don't know what to call it, like a little wart or something like that. And it would peel off, be gone. It would grow back again. I don't know if it was something like an actinic keratosis or some kind of viral thing. I'm just not sure. But anyway, if I'm on the low-dose naltrexone, it goes away. It's gone. If I get off of it, it comes back.
So that's 4.5 milligrams is what you're taking, correct?
Yes. It was the way it was. It was body weight. They do. I get it from a place in Colorado, a pharmacy in Colorado through your phone, and they're about the cheapest place that you can get it. If you go to a local pharmacist, compounder will charge you about $60 for a month's supply. If you go through this Colorado pharmacy, it's about $15 for a month's supply.
Oh, perfect.
About 3 months supply of it at a time. I sometimes get 6 months at a time. But the other side effect that I had, and I actually went to a friend that you had on the radio, Dr. Joffrey, about this years ago, is he called it a Taylor's bunion. I knew I had a bunion.
Yes.
That's what they called it. So, and there wasn't much he could do for it either. He told me to go get one of the bunion compresses and put it on that side. I guess it's because Taylors would cross their legs. I don't know why I get it, but for some reason on the the lateral side of your foot, I get this bunion, and it gets painful. Walking that, if I'm on low dose naltrexone, that thing goes away. The inflammation that goes away, and if I get off of it, it takes maybe a month or so, and it starts to come back. Now, you tell me that isn't two strange side effects.
I think that I wouldn't look at the side effects. I'm saying people are taking it for abnormal growths anyway. They actually call them cancers. That's how abnormal they are, and they're working just fine for them. So you can have non-cancerous lesions that are going to benefit from them too. And I'm glad to hear you are getting that benefit. And I just want to be able to know from you, and you can call up and give the number to Kim, the group in Colorado that has such a reasonable price on this naltrexone. It'd be a number that I'd be interested in getting from you.
Oh, sure.
Okay.
As soon as I get my prescription bottle, I'll look at it and
give us a call, and because we'd like our patients to. We got a number of people on it to get it the most. How'd you find it? How'd you find it so reasonable?
Oh, years ago on the internet.
Oh, really?
There's a naltrexone group, like a people post to.
Okay.
Blog. It's a blog, yeah, and they had it on there. I think it was through the group that does it for MS.
Very good. Well, make sure we get that number, David.
I will. It's great stuff. All it does is block your endorphin receptors so that you keep on making endorphins all night long. So when you wake up in the morning, you're loaded with endorphins. It's kind of like the old cousins, laughter is the best medicine.
Right.
Great mechanism. Great drug.
Thank you for your input, my friend.
You bet.
Okay. There you have the word from David. By the way, we'll get that number if you are on low-dose naltrexone. I mean, for him to be able to get that at $15 a month supply is pretty doggone reasonable. I don't know of any other that reasonable. We got another knock on the door. Come on in the store. Hello, welcome aboard. What's on your mind? Go right ahead.
Hi, Dr. Courtney.
Hi.
I was wondering if you had any patients that, or any therapies that work with multiple chemical sensitivity.
Oh.
I have underlying Lyme disease. I had a tick bite when I was 11, and I'm 46 now. and I was exposed to toxic mold in the home, and it's just wrecked my life, and I'm chemically sensitive.
Sure.
And I wonder if any of your therapies, if you've had any success with that.
There's one group of therapies that are specifically targeted to correct, and I underline the word correct, meaning fix, meaning the C word, called LDA. You familiar with LDA?
Yes.
Okay, so my recommendation for you would be go to drschrader.com, which is the website of William Butch Schrader, drschrader.com, and the written word on LDA, which is low-dose antigen, which is specifically designed to eradicate all those kinds of immunological responses to chemicals. The nice thing about the mixtures used in LDA is that no testing is really necessary because the mixture supposedly contains all those chemicals that you could come across in the daily living. So we don't have to test you and figure out which one it is. They're all in there.
Okay.
And within a year...
Do you do?
What's that?
That's something that you do at your office?
Yes, we do. There are 90 doctors throughout the country who are trained by Dr. Schrader. I happen to be one of those 90. And we do LDA, a good dose of LDA every single month around here. We have a number of people who are on it. You get an injection once every 2 months for a year before you can open that up and maybe go to once every 3 months or once every 4 for a while. And then by the time a year or two goes by, you're only supposed to need that injection maybe once a year or once every year and a half. That's pretty good.
Oh, wow. I had read some of the things on his website. I'd been looking into it, and I felt it's very restricted. Do you recommend sticking with all the restrictions that he has as far as the diet, avoiding this and avoiding that?
It's not a recommendation. If you're going to do LDA, it sort of comes with the territory. You then know that there's a special diet. That diet is to be done on the 3 critical days of this injection, and that is the day before the injection, the day of, and the day after. Those 3 days, there are only a certain number of things that you can't eat, and the idea behind them is that the foods that are selected have a very low chance to provoke immunological response. They're just sort of bland foods. They don't contain any chemicals and the like. And they're safe for those 3 days. Because when you come in to get the LDA injection, we only want you to react with respect to your innate immunological responses, not those triggered by what you may have eaten that day.
Right.
Okay?
See, because of my chemical sensitivities, I can only eat 4 or 5 things as it is. So the only thing that I can eat on that diet is lamb. So I guess I would have to eat lamb for 3 days.
Okay.
Everything else I react to so severely.
By the way, when it comes to these meats, I mean, the list doesn't say, but I can certainly add to it. How about rhinoceros, elephant, or wild mountain lion? I only say that because they don't have any chemicals. I mean, and so venison and lamb and all this stuff lamb are not known for being fed grains or anything like that. So they're a good source, and I think it's a wonderful thing to be able to eat. You can't eat any of the vegetables either?
I do broccoli every once in a while and some zucchini. I have intestinal dysbiosis as well, leaky gut.
Mm-hmm.
So it's just kind of a toxic storm.
Well, you should know also that besides chemicals, which this conversation started out you telling me that you have chemical sensitivities.
Right.
All those foods that potentially can give you a problem, we cover those too, so that there'd be no reason to just take the chemicals mixtures only. You want the foods, and making certain that you could reverse them all, it would be the benefit to you.
Uh-huh.
So there's quite a bit. I'm glad to hear you read on the website about them. Come on in so we can establish a doctor-patient relationship on this one, and go for it. Seems like you've got quite a bit of sensitivity going on. You need to turn this. You need to shut that down.
Well, thank you so much. It was good talking to you.
Nice talking to you too. Yes, LDA, low-dose antigen. William Butch Schrader is the guy who brought it here. Go to his website at Dr. Schrader. That's DR without a period at the end. drschrader.com. There you will read the best written word on the subject. And as a final note, head to my website at djcmd.com, scroll to November 2012. And in 2012, November, every Friday's show was an LDA show. Started out with the Godfather himself. So I would encourage you to listen to those shows. And another knock on the door. Come on in the store. Hello, welcome aboard. What's on your mind?
Hello.
Hello.
A question about my joints, my neck, knees, ankles.
Okay.
And I'm in my later 60s. Worked pretty hard, and nothing I can take, and I'm afraid of any drugs. I take some Ibu tabs and give me slight relief.
Okay.
But I understand that you have some shots now available.
The ozone injection. The nice thing about it is it's not a drug. It's oxygen.
Okay.
And so those who have sensitivities to drugs would find there's just a natural being put at ease here by hearing that you're not going to get any drugs while we do our work here, because ozone is not a drug. We don't use drugs here. So that should make us really good friends right from the beginning.
Yes, it does.
Okay.
And my question is, how would I get a hold of you to set up an appointment to see if I or talk to you about this other than on the air?
Yeah, well, give us a call here at the office to set that up. The number is 724-942-3002. And we'll sit down and we'll have at it and see what kind of plan we need to put into play for you.
Okay, thank you so much.
My pleasure.
All right.
There you go. There you have it, folks. A lot of folks are taking us up on this, especially if you've had a chronic pain problem for a lot of years and nothing's working for you. You got to give us a try. Absolutely have to give us a try. And to do so, just dial us up at 724-942-3002. Now, we're pretty much in that gun lab. We've got a few minutes left to go. I'll entertain an additional call, maybe two, 412-825-6262. If you think you'd like to get in on it, 412-825-6262. One little thing I think I will mention is that my apology goes out to all the men that I've been treating, because it appears as though I've been shortchanging you with respect to your thyroid. And we learned earlier in the month when we had Dr. Mark Starr with us that there's a heck of a relationship between thyroid disease, heart attacks, heart failure, and diabetes. So much is that relationship that I've decided, as I've been encouraged to by Dr. Starr, all my men are going on thyroid hormone, just like all of my ladies are already on thyroid hormone, and we're going to stem the tide of the cardiovascular debacle caused by that relationship. Got another knock on the door. Come on in the store. Hello and welcome aboard. What's on your mind?
Hey, good morning, Dr. Courtney. Thanks for taking my call, sir.
Sure.
If you had to construct a list of your target audience for uses of liposomal vitamin C, like maybe in a prophylactic manner, like what purposes would you recommend that you take that particular form of vitamin C to combat what conditions, so to speak?
Well, I would say there are three. The first of which, actually, I think the vitamin C, which was my #1 go-to, when I wanted to have somebody have daily antioxidant protection, vitamin C was my go-to way of handling that for a lot of years. However, started in April of 2013, when we learned of a product called astaxanthin, vitamin C is no longer my go-to antioxidant. It's astaxanthin all the way. Number two, the second reason that you use vitamin C, and this is in vogue, is if you want to kill viruses, there is no better way to absolutely kill viruses than to take high-dose vitamin C, liposomal or intravenous, and with the liposomal you do have a way of getting some pretty high doses in play. And the third thing that I would use vitamin C for in high doses in liposomal form would be it is able to eradicate cancers. It's one of my biggest uses when it comes to patients who suffer from cancer. Now, I usually use IV forms, high dose, 75,000 100,000 milligrams of vitamin C. But because vitamin C will kill viruses, it will kill cancers, and it is a pretty good antioxidant. Those are the three that I see it. And then I see the last two of those three, there is no equal when it comes to viruses and cancer kills. Vitamin C is the number one.
Outstanding. So would you invite me, for instance, to order some of that instead of trying to make it myself from your office and then just use it on a regular basis?
Well, I find that the
first ones that get better.
Yeah, the commercial forms of vitamin C, liposomal vitamin C, just makes it no fuss, no muss, but there's an expense to it that if you're really looking to cover a large variety of issues and trying to do it economically pleasing, then making your own. We have kits here that actually, the whole kit and caboodle, all the vitamin C, the lecithin, even the jewelry cleaner that's needed is included. So it's pretty, you can for pennies a dose, you can make your own, and if you wanted to take large amounts, you would want to make certain it was liposomal, because to get water-soluble forms is a waste.
Sounds like a plan. I appreciate your help.
Absolutely, my pleasure. Thanks for the call. There you go. And we still, by the way, ladies and gentlemen, still have those kits. Well, if you did find, just folks, we switched our gears. Our David Steenblock, I promised to report what happened with David. We don't know. Maybe we'll bring him Friday if he's in the mood for it. We'll see. So until then, I want you to have a wonderful remainder of the week. This is Dr. Dennis Courtney saying so long for AM Impact on Your Health.